So good afternoon. My paper for today is on knowledge, attitude, and practice pattern among ICU nurses on eye care practices in ICU patients. Here are the contents. Eye care forms a major part of care provided to all patients in ICUs. Critical care nurses have limited knowledge about the anatomy and physiology of eyes and ocular manifestations in critically ill patients, which may lead to a delay in the identification and delivery of proper eye care. My objective is to estimate the knowledge, attitude, and practice pattern of nurses regarding the eye care in patients admitted in the ICU in a tertiary care center. A descriptive study was done among the ICU nursing staff with a well-structured questionnaire. My study included 74 nursing staffs. Participants' age, gender, education, experience in critical care, type of ICU, previous eye care training was noted. Data was collected in the form of a questionnaire. Here you can see is the questionnaire. It had 3 sections, knowledge, attitude, and practice, with 7 questions in each section. The questions in knowledge assessment were on different ocular signs in the patients, their risk factors, management with 2 or more correct responses. A score of 3, 2, 1, or 0 was given respectively according to the response. Participants were again further grouped based on their score into good, average, and poor. Questions on attitude was based on the importance of early detection, treatment, and prevention of eye disease. Positive response was given a score 1 and negative a response of 0. Depending on the total score, attitude was again further graded into good, average, and poor. Now, practice again was assessed based on the method and techniques of eye care practiced by the nurses in the ICU. The response to each practice pattern was again noted, and the participants were graded into good, average, and poor. Statistical analysis was done. And now moving on to the results. 74 of the ICU nurses included in my study. The mean age was 33.7 years. 92 were females. 93% were BSc graduates. 35% of them underwent eye care training. 54% had 1 to 5 years of experience in the ICU. 20.3% were from the neurosurgical ICU. 78.3% of the total study participants had average knowledge. Most of the participants answered that ICU patients were at a higher risk for exposure keratopathy. As you can see in the bar diagram, it's 86.48%. And least knowledge level was for the question on reasons for developing exposure keratopathy, which is 54%. 50% of the study participants had good attitude. Out of the 7 questions on attitude, maximum positive response is for the question the effect of eye care in preventing eye disorders, which is about 90%. And least positive response is for the question on what to be done on seeing a patient with incomplete eyelid closure. There was no significant correlation between the knowledge and attitude score. Majority of the participants had an average practice, that is 54.1%. Maximum response was for the question on last assessment of lid closure, that is 78%, and least response was for the question on the method of cleaning of the eyes of these ICU patients. 66% of the staffs assessed eyelid closure in their last duty. 59.5% of the participants assessed eyelid closure hourly. 37% of the participants instilled eye drops 3 hourly and 6 hourly. 41.9% responded that they had used distilled water to clean the eyes of the ICU patients. 50% of the participants cleaned the eyes hourly. 60% had done eyelid taping for incomplete eyelid closure. And 60.8% of the participants followed a fixed protocol, of which 28.4% of the participants responded saying that they got the protocol from their seniors. Now moving on to the discussion. 93% of the participants were BSc graduates and only 35% had undergone eye care training. Majority of the participants had average knowledge and 50% had good attitude. And majority again showed an average practice pattern. So in our study, we observed that both participants with good knowledge and average knowledge showed a good attitude and an average practice pattern. And there was no correlation between knowledge and attitude score. Now, similar to our study was a study by Khair and et al. Now, in contrast to our study, a study done by Mariam et al. Showed a positive correlation with good knowledge and attitude in their study. And another study by Ebedi et al. Showed that the participants had limited knowledge and showed a positive correlation to attitude. Now, majority of the staffs assessed the eyelid closure of their patients in their last duty, and 60% of them reported that taping of eyelids for incomplete lid closure is similar to a study by Aditi Vida et al. In a study by Sonal et al., less than a quarter of the nurses responded that they were unaware of the high potential risk of the exposure keratopathy, and 50% of the nurses checked eyelid closure and took preventive methods to prevent exposure keratopathy. And an awareness program, along with a protocol-based approach, can improve the knowledge. Now, post our study, an awareness class was held in order to improve the poor knowledge and attitude. And here is a new protocol, which includes grades 0, 1, and 2, along with its treatment approach. Now here's the conclusion. Ocular complications can occur in a large number of ICU patients due to a lack of awareness, which leads to a delay in the identification and management. A clear protocol can improve the quality of eye care in these patients. Here are the references. Thank you. So it was our hospital, so it's a private, yeah, yes, sir, private hospital. Yes, sir. No, sir, the ICU doctor would inform us whenever there's a need of any, if they found there's any need of any eye related issues, they would call us. That's when we were informed. Not on a regular basis, only when the ICU doctor used to inform us. So some said that they did have an eye care protocol was there, but not everybody had an eye care training. Only few of the staffs had an eye care training, sir. Just 35. So 35, most of them were senior faculties who had 1 to 5 years of experience, sir. Most of them had a lesser experience, like around 1 or 2 years, but most of them who had had higher experience were giving a better treatment, sir. Yes, and drugs. So there was no significant correlation between them. Yes, sir.
Even if they knew their attitude was poor, it wasn't done.
Yes, sir. If the attitude, if it's with good, we can improve the knowledge, sir. But here, if the attitude is poor.
What recommendation would be there after your study? The use of doing your study, what recommendation?
So in my study, I found that the knowledge was average, but the attitude was good. If the attitude is good, we can definitely give them awareness classes, including with the protocol that I said. We can improve their knowledge. And so since there was no really bad practice pattern, so the practice patterns can also be improved. Thank you, sir.